Amanda DeGregory. I'm the pediatric educator, and I'm going to go over the Atom infant warmer. So I wanted to go over first what we stock on the infant warmer. So we have a checklist of first how to turn it on and the steps to plug it in and turn it on, and then what should be stocked in the infant warmer on top and in the drawers. So on top of the infant warmer, we have various things. So we have 2 infant size O2 masks, or for the ambu bag, or the T-piece. We have various sections. So we have a suction catheter, the bulb syringe, a mucus trap, and over here we have the temperature probe. And also this is a sticker to cover the temperature probe. We have a T-piece or a neopuff. We have infant EKG leads and an oximeter. Over here we have 2 umbilical clamps for a delivery. Here we have extra blankets and a hat. This is to keep the baby warm. We have a thermometer here. This one is a rectal thermometer. And that's it. So when we have an immediate delivery or a potential delivery, we want to bring the infant warmer into the room, and the first step is to get it plugged in. So back here we have the power cord, so we want to plug it into power. Then we have oxygen and air, and it's really important that both oxygen and air are plugged in, as the suction and all the features won't work unless both of them are plugged in. So we have oxygen, air. It will beep like that or alarm until both of them are plugged in. That's normal. So once both of them are plugged in, you'll hear the oxygen a little bit and it will stop alarming. Then over here, we have it labeled. So number 1, 2, 3, and so the first step will be turn on the power. The power button is here. Because one of the more important things that we want for a delivery is for the bed to be warmed. We need a warm bed for the baby. So we have up here, this is the temperature for the baby, and this is the set temperature for the device. So right here, it's set for servo mode. So this is when the baby arrives, but what we want before the baby arrives is manual. So we're gonna go over here, press and hold manual, and we wanna turn this up to 100%. So while it's flashing, down here, we'll turn it all the way up to 100%. This is going to start warming up the bed. Then once the baby comes and we have the temperature probe on, we'd press and hold here. And this is how you would set the temperature. You can set the temperature while this is flashing. If this is not flashing, it won't work. So you go back here, press and hold till it flashes, and you can increase or decrease the temperature. 37 is usually standard, so that's fine. So we'll go here. The bed is now warming up. And that's one of the more important things. Here we have a light, so you can turn this light on, and there's an overhead light here. This is really helpful to be able to see the baby and see what you're doing. So that's a nice feature. Then we're gonna go to number 2 to turn on suction. So we'll turn that on, and you can adjust it here. Usually we're gonna have it around 8 to 10 here to start with. Number 3 is we're gonna turn on O2. There's 2 different sides here. This one is if you're gonna be using a bag valve mask or a anesthesia bag. Normally we're not gonna use this side. The side we're gonna use more often is gonna be here for the neopuff. Also, we wanna turn this to 21%. For deliveries and neonates, it's a little bit different. We're always gonna start at room air and dial up as needed. So we'll start at room air, and then we're gonna turn up our oxygen here. So right now, we'll turn it up to about 10 liters. Now we have the neopuff here setting. There's a This is the attachment here. It can come out, but ideally we want to leave this in at all times. Then we have our Neopuff here, or a T-piece connector. We're going to plug that in here. Then we're going to set up our settings here. Take that off. We'll put our mask here. That's true. If we want to set it up, we can leave this on for now. And we want to set our pip and our peep here. And on here is a really good reminder of what our settings are. So we're going to have our FiO2 at 21%. Here's our T-piece or bag valve. We're going to have 20/5 and our flow of 10 liters. So this is a good reminder of what our settings should be. So to set your pip and your peep is going to be set by this. It does say peep on here. Okay. So we're going to set that. So the peep is going to be, so you would dial here until we get to 5. Let's see if we move that, it'll go up and down. So till about 5 right there. Then to set the pip is we'll occlude here, put your thumb over here, make sure this is occluded, and then we occlude here, and we want to set that to 20. And the way we adjust it is this knob here. So it's a little bit above 20 right now. So we're going to turn that down till it gets to 20. So now we have our peep of 5 and a pip of 20. So those are your settings. Now it's ready. If you need it, we can put the mask on and your settings are ready if needed. This can be used to give breasts, or it can also be used just as CPAP. So if you were to put this over the baby's mouth and nose, if you just hold it here, it's actually giving CPAP with a peep of 5. If you did need to give breasts, you would occlude here, and this is how you would give breast to the baby with our settings of 20/5. And this is me giving breasts, and you can see the settings here, and that's how you can keep track of your pip and your peep. So that's that scene. When the baby also is here, you want to hook up the temperature probe to them. So you would undo this. This is the tip that would go against the baby's skin. The best place to put this would be right over the abdomen, kind of over the liver area. So it'd be on the right upper abdomen. You'd put this on the baby, and then you would put a sticker. These ones are usually they're foil, sometimes they're a duck or a square, or this one's a heart. And you'd put this right over. So it'd be over the baby's abdomen with the sticker over it. And that's going to start monitoring the temperature. So when this is on the baby, you would then turn it here, the servo mode, or I call it baby mode. This is going to be your baby's temperature that you have, and then this is your set temperature. So it'll automatically read the baby's temperature and adjust the heat to get the baby's temperature to 37. When you have the baby on the infant warmer, you want to make sure that the baby is uncovered because the heat is from up above. So if you have the baby covered in blankets, then it's not getting the proper heat. And you would make sure the blankets on the infant warmer are to dry the baby, not necessarily to swallow. You can swallow the baby later, But the main thing is you want to take the blankets and really dry the baby off immediately after delivery. You want to put the hat on immediately after too, to keep them warm and let them retain the heat, their body heat. So then so a couple features that the infant warmer has is the sides come up and down, and the nice thing, you can just drop the sides if needed. All sides go up and down, you just pull it up and drop it down. The nice thing also, if needed, is this is an X-ray tray. So you can pull that out, and it has a tray. And the bed can tilt up and down too. So if you need to, it can tilt back and forth. There's a little handle down here, and you can feel when it's level here. So you can use this on either side. If doctors or nurses, you can have all sides down to access the baby. Down here is a drawer that can also be opened from either side. And this will have extra supplies here. So extra umbilical clamps, temperature probes, suction catheters, thermometers. This can come out here, and there's even more supplies here. So extra hats, some diapers, blood pressure cables. And then over on the other side of the drawer, is we have a neonatal stethoscope. This should always stay with the patient, with the warmer. So it's just a smaller one that's designated just for these infant warmers. And also we have chemical warmers here. So this is if we want to keep the baby extra warm. So it's essentially very similar to a heel warmer, is that you would fold it and knead it, and then it warms up. So it's just like a heel warmer. And it will tell you what side to place the baby on. Usually it's the softer side here. And you would lay the baby, you can lay this on the infant warmer, place the baby on top of it, and then it's getting heat from below and from up top. You can also use this for transporting as well. So if you just want to put the baby on top and wrap the blankets over, that also can keep them warm. A couple other features that this has is you can, up top here, you can swing it out of the way if you need to do something. You can also tilt it to either side, and it will indicate here that it is tilted to make sure that the heat is on the baby if needed. There's a silence button here for any alarms. And there also is a scale here. This one is not attached, but the scale here can weigh the baby. So it's essentially, you turn it on, it would ask you to pick up the baby, you zero it, and then place the baby back on, and it will weigh them. Here's also a kind of a cheat sheet for APGAR. So you can do quick APGAR scores at 1 minute and 5 minutes. And the other thing I always like to point out here, so these are the settings that you should have if you ever forget, and kind of what should be on the warmer. But down at the bottom here is really helpful. So down here is target SpO2 sats after birth. So if you can remember, after 1 minute, the actual normal sats of the baby can be 60 to 65%. So they're just coming out, and their circulation has not fully developed quite yet. So it's sometimes not until 10 minutes later that their sats can actually be normal. So sometimes when you have a very new baby and their sats are very low, the first reaction is to put oxygen on, when actually this is normal for the baby. So you don't necessarily need to revert to oxygen right away. A lot of times NICU will kind of give the baby some time and go based more on the APGAR than their O2 sats. daily checks. Really important to check that everything is on the bed. So every day it should be checked to make sure all your supplies are on the bed. There's the checklist. The other most important thing is that the infant warmer is plugged in when not in use, because this does have a battery that will last for about 30 minutes for transport. So you can't actually transport a baby on this. And you can always check every day that the power is on. So it is plugged in right now, but you can actually turn the power off and on, which we should never really need to ever turn the power off and on here. So ideally this should be on at all times, and just keep it plugged in. And that's the infant warmer.